From London, this is the Standard Podcast, and I'm Mark Blunden. Coming up, will Chancellor Rachel Reeves impose public spending cuts? But first, a damning report into the state of the NHS has revealed patients are dying in corridors and can go undiscovered for hours. The Royal College of Nursing published new findings based on the experiences of more than 5,000 UK nurses into the state of England's hospitals as staff try to manage the number of people needing care. What was described as a harrowing report tells of patients sitting for days in chairs due to a lack of beds, patients piling up in the corridors, delays to treatment, and the elderly unable to get help due to no call bells and not enough staff. It comes amid soaring ambulance waiting times, with emergency cases increasingly clogged up in the hospital system as patients often endure lengthy waits to get seen. Now, the Standard Podcast is joined by Mathew Hulbert, a volunteer patient leader at Just Treatment, and their campaigns include increased national healthcare investment, fair pay for NHS staff, and an end to outsourcing NHS services. His 78-year-old mother Jackie died in July 2022 from sepsis in hospital after waiting 11 hours for paramedics in Leicestershire following a fall at home, and he shares what happened.
My dear mum Jackie fell at home in July 2022. She'd fallen before. She fell on her bedroom floor. Myself and a friend got to her. This was in the early hours. She said she'd hurt her ribs. So obviously we didn't try and move her, and the advice was not to move her when we called for an ambulance. My friend called for an ambulance at 5:01 a.m. They did say in the call that, it could be up to 10 hours, but they didn't think it would be anywhere near that. Well, in actual fact, it ended up being 11 hours that mum had to wait before first a paramedic arrived at around about 4 p.m. in a car, checked mum over, further called for an ambulance, which then came shortly after that. Mum was taken to hospital, where she died 2 days later after an infection turned to sepsis. Since obviously this dreadful thing happened to mum and I decided to then campaign on this issue, I now see countless stories, and often worse actually than what happened to my mum in terms of how long people are waiting. And it is shocking, and it's happening in every part of the UK. I watched a debate in the Northern Ireland Assembly this week on this very issue of ambulance delays, and I know that Scotland has had its problems and Wales too. This is every government, and obviously, they all have different governments that run the health service. This is happening in each part of the UK, and no one seems to be able to get a grip on it and get things sorted out.
What is your response and Just Treatment's response to today's RCN findings?
I think they're shocking but not surprising, because this is what we're hearing time and again from myself and fellow patients who Just Treatment works with. And one of the unique things about Just Treatment is that we're a patient-led campaign, and sadly we're hearing this the whole time, and clearly it's not good enough. I mean, patients deserve to be treated in a timely manner. They deserve to be treated with dignity, and I don't think we could, someone being treated in a cupboard or whatever, I don't think we could ever call that a dignified situation. And again, I'm absolutely certain that, for the doctors and nurses, this must just be awful. They obviously get involved in that profession because they want to help people and they want to do so in a dignified manner, and that is not what is happening. And so we need the political leaders, and this isn't just West Streeting in England, this is across the UK, and the different health secretaries. We need them to really get a grip on this situation. And again, that is going to take, yes, reform, but it is going to take much more money too.
What is your view on how the government is going to do this? How they're going to find the extra cash? What pot is it going to come from?
Well, at Just Treatment, we're unashamed in saying that we need a more progressive tax system, and that those that can, those that have been very successful in their lives, and good on them, should be asked to pay a wee bit more. Now, I know that's a controversial thing to say for some, but our view is that you can't. What the government in England is trying to do, the Labour government seems to say that we can have all these tight fiscal rules and we're not going to put up any taxes, but also you can have much better public services. Well, the one doesn't lead to the other, in our view. Our view is that to properly fund a health service for goodness knows how many millions of people, that is going to take money, and one of the only ways to do that is to have a progressive tax system, and so that is certainly what we're calling for.
How does Just Treatment's campaigning support other families, and are you able to share any other stories?
I'm thinking of a lady who has become a friend who we've both been to Downing Street twice now, once with the last government and once with this government, to take in a petition basically calling for what Just Treatment is hoping will happen in terms of extra investment in the NHS. And what happened to her husband was that he had a heart attack and the ambulance took longer than it should to get to her. And sadly, her husband died in her arms. I also think of someone else who had to drive his very, very poorly granddad to hospital and then carry him in his arms across to the hospital. Thankfully, the granddad did survive that particular incident, but has subsequently passed. But in a lot of these cases, it is just the indignity of how people are left to be because an ambulance doesn't arrive in a timely manner.
Health Secretary Wes Streeting told the Commons on Wednesday that he cannot promise that there won't be patients treated in corridors next year. Let's go to a quick break. Coming up in part 2, Treasury Minister signals cutbacks in some public spending to pour more funds into the dash for growth. What we know. If you're new here, please do make sure to hit follow and give us a rating. Welcome back. The Deputy of Chancellor Rachel Reeves has signalled cutbacks in some public spending to channel more funds into the Labour government's dash for growth. Chief Secretary to the Treasury, Darren Jones, played down the suggestion that Reeves would have to deliver an emergency budget in the spring when departments will be told their spending limits for the year ahead. It came as the Office for National Statistics released data on Wednesday showing GDP was up just 0.1%. The first month of growth since August, but lower than the 0.2% forecast by City economists. Now we're joined by the London Standard's political editor, Nicholas Cecil, who explains what we know.
What we've learned is that there is a spending review going to take place in June, and a couple of things. One is that the Treasury, Chancellor Rachel Reeves, is going to call in cabinet ministers, put them in a room together and make them all come up with savings from their departments, basically to achieve the government's key aims of growth, tackling NHS waiting lists, improving living standards and so on. So it's a bit kind of essentially putting pressure on these cabinet ministers to do their part to deliver the government's agenda, which is very, very much targeted on delivering economic growth. Now, the other thing which we now know is that while the government deny that these are cuts in public spending, there will be what the Chief Secretary of the Treasury, Darren Jones, who is Rachel Reeves' deputy, describes as reprioritisation of funding. So all departments are being asked to do zero-sum reviews of their spending. So looking at every pound that they spend and saying, do we really need to do this? And what the new Labour government is saying is that there's some things that money was spent on in the past, which it views as no longer being priorities. And some of this funding will be funneled into better funding the government's current priorities. So there'll be money will essentially be moved around, which means that some areas of public spending will get less money, while other areas will get more money.
Do we know which departments are most vulnerable, and how can this be so at a time of record government borrowing?
We don't have any details yet. The Treasury and the departments will be going over the figures in the fine detail over coming months. The vulnerable departments are always areas like justice, policing, local government, and there's no doubt there is waste in the system. There is money and savings to be found which can be better spent on the things that is currently being spent on or on different parts of the public services where it could deliver bigger benefits. So yes, there are savings to be made. We don't know yet. And in terms of why do we need to make savings now, Britain, like all countries, has suffered from the COVID pandemic, a once in 100 years event. We are also having to deal with Vladimir Putin's war in Ukraine, which has sent energy bills rising. There are other factors such as Brexit, which have also hit the public finances. So the economic situation facing the country is very difficult. And yes, the government has come in. It's borrowing some £30 billion more. It's raised taxes by some £40 billion. And it's spending another £70 billion or so on public services. But there is also this growing crisis with the cost of government borrowing going up. And if you look at the state of Britain's public services, the NHS is in an absolute dire state. Our prisons, we're having to free prisoners because they're so full. So the public services clearly need more funding, even if the government is borrowing more.
Well, it's welcome that the economy is growing, albeit modestly, and today's numbers just strengthen my resolve that we need to go further and faster in delivering growth to make people in Britain better off.
The Chancellor there speaking to the PA News Agency. All this comes as we heard news today from the ONS, their latest growth data, just 0.1%. Is this going to increase the pressure on number 11?
Yes, it will increase the pressure on number 11. The figures were, they're positive. So it's a tiny, tiny bit of economic growth in November. It was less than what the city was expecting. Most economists had penciled in kind of 0.2% growth. It was 0.1%. It's not a huge difference. Essentially what it means is the economy is flatlining. It's been flatlining for months now. And certainly there are warnings from business chiefs and from the Tories and other opposition MPs that Rachel Reeves' budget is actually contributing to the economic very slow growth, if any growth at all. What the new Labour government argue is they've got a series of reforms coming through, like changes to the planning system, which will help to boost growth. But it's still a big question over whether Rachel Reeves can deliver that.
And that's The Standard. For latest news, head over to standard.co.uk. This podcast is back on Friday at 4 p.m.